The Hunger Project was founded in 1977 with a commitment to end world hunger. There are 925 million people in the world who are living in chronic, persistent hunger. This means that 1 out of every 7 people don't have enough to eat to lead a healthy, productive life. Chronic hunger, as opposed to famine, accounts for the vast majority, 90% of the hunger in the world. About 24,000 people die needlessly every day in our world as a result of chronic hunger. More than 3/4, or 16,000 deaths each day, are children under the age of 5. This is unacceptable. Our work is founded on a set of 10 principles: human dignity, gender equality, empowerment, high leverage actions, interconnectedness, sustainability, social transformation, an integrated approach, decentralization, and transformative leadership. Through integrated empowerment-based development strategies, the Hunger Project works with women and men to end their own hunger and poverty on a sustainable basis. Our programs are led by people who are indigenous to each country where we work, operating in partnership with local government and implementing on a scale large enough to achieve critical breakthroughs. Recently, international gatherings of world leaders have resulted in commitments to support development strategies led by the countries themselves. This has provided us with an opportunity to scale up our work like never before. So we're now working on leveraging this historic opportunity. We're committed to having our programs become excellent models for effective large-scale replication. We're improving our ability to document the impact of the actions our village partners are taking in their communities. And we're upgrading our capacity to advocate for the adoption of effective approaches at local, national, and international levels. We're able to work in this strategic way and seize new opportunities because of the unwavering support and partnership of our investors, who are strategic in their thinking and bold in their vision and commitment to fund our holistic approach. In order for us to accelerate the fulfillment of our mission, we're striving to expand that community of investors. The Hunger Project recognizes that it's the people in the developing world who are best able to answer the challenges they face. They have the talent and, when given the opportunity, the will to take charge of their own lives. They know their own needs and are aware of the resources their communities have or lack. So our approach is based on the world's most important resource: the creativity and self-reliance of people living in conditions of hunger and poverty themselves. Our work empowers them to be the authors of their own development. As a result, outcomes are sustainable and locally appropriate. We have identified 3 critical elements that, when combined, empower people to make significant progress in overcoming hunger and poverty. The Hunger Project mobilizes people at the grassroots level to build self-reliance. We empower women as key change agents, and we forge effective partnerships with local government. For more information on these key elements of our organization, please visit thp.org. Over the last 20 years, in partnership with village communities and villagers in Africa, South Asia, and Latin America, we've developed bottom-up, women-centered strategies to end hunger and poverty. In 8 countries in Africa, our mobilization strategy involves clusters of villages called epicenters. They work together to establish and manage their own programs for health, education, food security, microfinance, income generation, and gender equality. In 9 states in India, the Hunger Project trains and empowers women leaders who have been elected to village councils to be the key change agents for ending hunger and poverty in their villages. Across Bangladesh, we train and empower volunteer leaders called animators who mobilize their villages and strengthen local democracy so people can meet their basic needs. In Mexico and Peru, the Hunger Project focuses on the people who are most marginalized, particularly indigenous women. We carry out strategies to empower them to learn to read, launch new enterprises, and work in partnership with local government. The Hunger Project's programs are active in more than 24,000 villages worldwide, reaching approximately 35 million people, with more than 380,000 trained volunteers leading the way. We've developed a dynamic web-based data monitoring platform in partnership with our program teams to track activities and outcomes. Our system is consistent with our program methodology. It empowers our village partners to be the primary agents of their own development. Through trainings, they strengthen their skills to actively monitor progress, which is an integral component of our monitoring and evaluation strategy. Using this system, for example, we know that in 2011, our village partners planted nearly 90,000 trees. Over 150,000 women and men participated in our HIV/AIDS and gender inequality workshops, and that almost 15,000 women accessed pre- and antenatal health services in our communities. We also partner with leading experts in the evaluation field to execute external impact studies of our work and to ensure that we develop the necessary systems that demonstrate the long-term impact of our work in ending hunger. One of the questions we get asked is, what do we mean by hunger? For the 90% of the world's people who are chronically undernourished, hunger is a daily, sometimes lifelong reality. Chronic, persistent hunger is not due merely to lack of food. It occurs when people lack the opportunity to earn enough income, to be educated and gain skills, to meet basic health needs, and to have a voice in the decisions that affect their community. The Hunger Project empowers communities to seize these opportunities and be more resilient in coping with famine or other emergencies as they arise. Another question we get asked most often is, what about the men? First and foremost, our programs aim to achieve gender equality by empowering women to be the key change agents. Men participate in our programs as activists, investors, and leaders, and are an important part of this process, as a shift in their mindset is needed for this social transformation. Whether working with groups of women or men, or all together, the Hunger Project is committed to a focus on women's leadership as a critical element to achieving gender equality and the end of hunger and poverty. We do have some staggering results for the small budget we have. For example, 3.85 million people have participated in our signature workshop, the Vision, Commitment, and Action Workshop, where villagers create their own vision for the future, commit to achieving it, and formulate their plans to succeed. Since 2003, 1.1 million people have taken the HIV/AIDS and gender inequality workshop. Here, they learn the facts about the disease and also confront and transform their gender-based behaviors that fuel the pandemic. 83,000 elected women representatives in India have been trained by the Hunger Project and local partner organizations. This means 83,000 women are speaking out to bring water, health, and education to rural villages. But numbers do not always tell the full story. So here's just one of our many partner stories. Josefina Martinez started a nursery to produce and sell ornamental plants called Flor Feliz, which means happy flower, together with the other members of her income-generating group supported by the Hunger Project Mexico. Now, the nursery is growing not only enough to provide food to her family, but enough to sell the rest of the harvested vegetables at the municipal market. We are successfully transitioning from being a founder-led organization for over 30 years to new global leadership. Together with our village partners, our international board and staff, we are becoming even more effective as advocates for integrated development to end hunger and poverty in our world. One of our continuing challenges is to identify potential investors in the United States who are drawn to the opportunity to have a meaningful impact in the developing world. An increase in resources would allow us to operate to our full capacity in the countries where we already work and, when appropriate, expand to new areas. Additional funding would enable epicenters in earlier phases to move closer to meeting their own basic needs on a regular basis and ending their hunger and poverty. If every epicenter reached self-reliance, 1.9 million people would have access to a fully functioning, community-run epicenter with programs in health. With additional resources as an organization, we'd be better able to invest more in our education and advocacy efforts both in-country and in the United States, raising awareness about critical development issues and promoting the work we do more widely. We aim to be key players in each of the 12 countries where we work, and to influence how resources are allocated and how national development programs are implemented. With more resources, we'd hire new staff positions in the countries where we work. Those staff would then be able to cultivate high-level partnerships within government, civil society, and non-governmental organizations to pursue substantial private, multilateral, and government funding from within the countries themselves.